Hello everyone, and welcome. Today we're diving into a condition that might sound a bit unusual: bladder foreign bodies. We'll explore what they are, how they get there, and how they're treated. So, let's get started. So, what exactly causes a foreign object to wind up in the bladder? There are several pathways. Perhaps the most common is iatrogenic introduction. This could occur during a medical procedure, such as catheterization, where a fragment of a catheter or guide wire might break off and remain in the bladder. Intentional insertion is another cause, more commonly seen in individuals with psychiatric conditions or those seeking sexual gratification. Objects may also migrate from adjacent organs. For example, sutures from bladder neck suspensions or mesh from pelvic floor repairs can erode into the bladder. Finally, penetrating trauma, like a gunshot wound or stab wound, can introduce foreign materials directly into the bladder. Once a foreign body enters the bladder, several things can happen. First, the object irritates the bladder lining, causing inflammation. This inflammation can lead to increased bladder sensitivity and spasms. Over time, mineral salts, like calcium and phosphate, can deposit on the foreign body, forming a bladder stone. These stones further irritate the bladder lining and increase the risk of infection. The presence of the foreign body can also obstruct the flow of urine, leading to urinary retention and potentially even kidney damage if left untreated. Bladder foreign bodies are not a particularly common condition. Precise epidemiological data is limited, as many cases are likely unreported, especially when intentional insertion is involved. They're observed more frequently in adults than children, and the prevalence varies depending on geographical location and medical practices. Populations undergoing frequent catheterization, such as individuals with spinal cord injuries, are also at higher risk. The symptoms of bladder foreign bodies can vary significantly depending on the size, shape, and composition of the object, as well as the duration of its presence. Some individuals may experience no symptoms at all, while others may suffer from a range of complaints. Common symptoms include recurrent urinary tract infections, persistent pelvic pain, blood in the urine, painful urination, urinary frequency and urgency. If the foreign body causes obstruction, individuals may experience difficulty urinating or even complete urinary retention. Some may also experience incontinence. Diagnosing bladder foreign bodies typically involves a combination of physical examination, patient history, and imaging studies. A thorough medical history, including any recent medical procedures or relevant psychiatric history, is crucial. A urinalysis can detect signs of infection or blood in the urine. X-rays can identify radioactive objects such as metallic items or calcified stones. However, radiolucent objects, like plastic or wood, may not be visible on X-ray. Cystoscopy, a procedure where a small camera is inserted into the bladder, is often the gold standard for diagnosis, as it allows direct visualization of the foreign body. Ultrasound or CT scans can also be used to identify foreign bodies and assess for any complications, such as bladder perforation or kidney damage. While there aren't strict classifications, we can categorize bladder foreign bodies based on their composition: metallic, plastic, organic, or calcified stones. Another way to classify them is by the method of introduction: iatrogenic, self-inserted, migrated, or trauma-related. These distinctions can inform treatment strategies. The primary goal of treatment is to remove the foreign body while minimizing further trauma to the bladder. The method of removal depends on the size, shape, and composition of the object, as well as the patient's overall health. Small, smooth objects may be removed cystoscopically using grasping forceps or baskets. Larger or more complex objects may require fragmentation using lasers or electrocautery during cystoscopy before removal. In some cases, open surgical removal may be necessary, especially if the object is embedded in the bladder wall or has caused significant damage. Following removal, antibiotics are often prescribed to treat or prevent urinary tract infections. Bladder irrigation may also be performed to remove any remaining debris. It's also important to address any underlying psychological issues that may have contributed to the intentional insertion of the foreign body. Preventing bladder foreign bodies involves several strategies. Meticulous surgical technique during medical procedures can minimize the risk of iatrogenic introduction. Ensuring proper training and adherence to safety protocols during catheterization is crucial. Prompt management of pelvic floor disorders can prevent mesh erosion into the bladder. Addressing underlying psychiatric conditions and providing appropriate support can reduce the risk of intentional insertion. Patient education about the risks associated with self-insertion of foreign objects is also important. The prognosis for patients with bladder foreign bodies is generally good, especially with prompt diagnosis and treatment. Most individuals recover fully after removal of the object and treatment of any associated infections or complications. However, recurrent foreign bodies can occur, particularly in individuals with underlying psychiatric conditions. Recent research is focused on developing less invasive techniques for foreign body removal, such as robotic-assisted cystoscopy. Additionally, studies are investigating the long-term effects of bladder foreign bodies on bladder function and overall quality of life. Thank you for joining us on this exploration of bladder foreign bodies. We hope this information has been helpful and informative.